And it's this procedure I want to ask Dr. Greta about today. So Dr. Greta, there are two parts to penis enlargement surgery. There's the lengthening to make the penis longer in the flaccid state, and then we have a fat transfer procedure to make it thicker. Now, as I understand it, for the lengthening procedure, the surgeon cuts the suspensory ligament. Can you tell me, what is this ligament and how does it make the penis, as I understand it, hang lower to give the extra length?
It is a ligament which supports the penis, but it is one of the structure supporting this part of the body. So it is not a vital structure which can be incised without any bad things happening.
Okay. And when we cut this ligament, how does it make the penis look longer?
Because it supports the penis towards the pelvis. Then when you make an incision, it just drops lower slightly, and it looks visually that it got longer.
I see. And my understanding from our urologists is that it can make the penis look longer by between 1 to 2 inches typically.
Yes.
Yeah, okay. And then of course the second part of the procedure is a fat transfer procedure. And I know from our own experience at Moorgate, fat transfer has become really popular in recent years. Fat transfer to wrinkles in the face, fat transfer to buttocks, and now we offer fat transfer to the penis. Now my understanding is, with the advantage of fat transfer over perhaps dermal fillers, is the fat lasts longer than the filler.
Yes.
Yeah. So tell me a little bit about fat transfers. I understand it, some of the fat cells die after, but then the rest remains. Why is it that the rest of the fat remains after the initial absorption of the fat?
It is because those cells that die, they become necrotic, and that's not applied for all the tissue that you insert, because it's still a tissue anyway that's inserted in a liquid state. So that would be the main reason.
Okay, so presumably the fat reconnects with the blood supply and then lives. It remains like fat in the rest of our bodies.
And that's why we use some extra procedures involving platelets that enhances the chance of surviving.
I see. And I know now that there are lots of fat purification systems. I think we use one here at Moorgate. We use a fat purification system called Lipivage, which, as I understand it, is it removes the unwanted stuff, if you like blood and other stuff that you don't want in the fat. And once you get rid of that, it increases the survival rate.
Yes, because the fat should be pure without any other tissues, as it would increase the vitality of the tissue that's inserted.
And my understanding is, from penis enlargement surgery, certainly in the cases we see at Moorgate Andrology, that we're able to increase the girth of the penis by up to 2.5 inches with your own fat.
Yes, that's right.
And typically, where are the best places to harvest this fat from? Because obviously you have to be your own donor. You can't have your friend's fat. So this has to come from you. So where are the best parts of the body to get this fat from?
Usually, the tummy is the best place to take the fat from. So it's like you get an additional extra procedure as your tummy is being
flatter
reduced
at the same time.
And flatter.
Fantastic. So it's like a small liposuction that's done.
Yes, it is, exactly.
So at Moorgate Andrology, of course, our signature procedure, if you will, is penis enlargement surgery. And it's this procedure I want to ask Dr. Greta about today. So Dr. Greta, there are two parts